All right, welcome to live from HMPS here in Orlando, Florida. I'm excited to sit down with someone that just recently met, but I've known about you reputationally in a good way in the industry, and that's Skip. Skip, welcome to the show.
Hey, thank you, Chris. So I appreciate being on, appreciate the opportunity to talk to you about one of my great passions, which is brand storytelling and content strategy. So just so your listeners all know, your viewers all know, my name's Skip Hidlay. I'm the Chief Communications and Marketing Officer for the Ohio State Wexner Medical Center and the James Cancer Center.
Yeah, absolutely. And you spoke at the conference about branding, and your session title really intrigued me. The brand blur. Let's get into that, because I think there is a challenge within our industry around branding and it not being differentiated. Is that kind of what you were getting at there?
Yeah, well, I think the issue is so much of healthcare marketing has become really a sea of sameness. Mm-hmm. You know, we've done research in the past several months as we begin to work on a new brand creative platform for our brand. And what we've really found is that so much of healthcare marketing is really a little bit milquetoast. Nothing really stands out. You know, we're all sort of beating our chest, talking about we're the best at this. As other presenters have said, there's a lot of world-class care going on in the world right now. Mm-hmm. And so part of what we've done at Ohio State is really leaned in hard to authentic, fact-based storytelling on behalf of the brand. And we've created a new brand storytelling platform called Ohio State Health and Discovery. The URL is health.osu.edu. And what we do is we do stories that answer the questions people are asking in search engines that don't have a lot of existing content. So we're trying to fill gaps that answer the questions consumers have. Our target audience, I should say, is actually healthcare consumers, some of whom might be patients or prospective patients, but we're really trying to build the brand of Ohio State as an authoritative source of fact-based content and stories about healthcare, wellness, science, and discovery.
Yeah, and I think that's great that you're leaning into it, particularly in this day and age when, we hear a lot about content being now created by artificial intelligence and AI slop, they call it, right? That to have that authentic content to kind of cut through, it really will help to differentiate you, particularly those you mentioned you're using Google searches as a way to kind of feed some of the answers or the stories that you're telling. Is that right? Yeah,
absolutely. And in fact, our team has leaned in heavily to AI. In fact, we're serving as the pilot department testing AI and developing use cases for all of shared services in the Ohio State health system. But we've really resisted the idea of using AI to generate any kind of content that's going to be public facing. We may use it to help translate some complex material in a news release to make it more understandable, try to get it down to a 9th or 10th grade reading level and then rewrite it. But the content I'm talking about, the stories I'm talking about, are deep stories about our expertise in things like operating on skull-based tumors. We have two of the best surgeons literally in the world. They train other surgeons how to operate and remove tumors in very, very delicate places. Stories about patients whose lives we've saved when they've experienced emergent, aortic dissections. We had a great story that I shared, with those who attended the session yesterday about a young boy in Alabama who suffered a tragic accident, fell through a plate glass window. The surgeons in Alabama were able to save his life, but he didn't have the use of his arm. We have one of the world's preeminent nerve microsurgeons. So he traveled, his family brought him to Ohio State and to Dr. Amy Moore, and she was able to restore full use of the boy's arm in a major 7 or 8 hour operation. So it's stories like that really help distinguish your brand, right, and that really connect emotionally with consumers, with readers, with patients, and really start to create engagement.
And that connection, that authenticity that drives to that emotional connection, or maybe the emotional connection supports the authenticity, I'm not sure, but there's a relationship between the two, for sure. That really helps when you're in, like you said, like the sea of sameness that a lot of health systems are at. I mean, and I think, adopting a content storytelling approach is really a way that every health system can do this. But doesn't that require a lot of infrastructure and support and resources to do? I mean, how much of tell me a little bit about operationalizing that.
Well, so it's a great question. And so what's so interesting, Chris, is I was stopped today in the hallway by a young marketing leader working for a small group of physician practices in suburban Pittsburgh.
Okay.
And she stopped me and said how much she enjoyed the conversation, and she wanted to get started on it. What advice did I have? She's a one-person shop.
Yeah.
And I said, well, here's the way you do that. I said, first, you do it one story at a time, identify those stories. One of the things I talk about is how we lean into the physicians as kind of the main feature of a lot of our stories. We're positioning them as our experts, positioning them for their compassionate care. And I said, so find those interesting stories. I said, and then maybe try to make the case for a little bit of money to hire some freelance writers, videographers, photographers, and then you become kind of like the editor, the content chief. And I said, you'll see it'll all work together, and it doesn't require a lot of infrastructure, does not require a lot of expense. And the physicians love it, and as you start filling the ecosystem with this content, you'll find consumers love it, and it creates engagement.
So there's a lot of things there that you said that I think are really important to lean on. First of all, the path of 1,000 steps begins with one, so start small. Don't try to boil the ocean.
Yep.
Secondly, it's you can build alignment and engagement with your physician audiences, and that in and of itself is also supportive of your brand, your overall brand.
Absolutely, because ultimately what I like to say, Chris, is building your brand puts you in the decision set with the consumer. But ultimately, depending on what the consumer's health challenge is, they're going to do deep research. Mm-hmm. And so they're ultimately going to make the decision. A, they've heard about your brand, they like your brand, they think you're good, but they're ultimately going to choose a physician to receive their care from. And so that's why we put the physicians in the center of the majority of our storytelling, either as experts or as the subjects in their interactions with patients, to show the type of care that we deliver that is really leading edge.
Yeah, absolutely. And I could see that this content, that even though you're building it from a branding platform, that content, these stories can be used in multiple different ways, right? From fundraising perspectives through your foundation, you can use it for internal employee engagement. I mean, that really shows you that the brand building that you're doing is truly brand, because it's applying to all the stakeholders in your ecosystem. Is that fair?
Yes, it absolutely is fair, Chris. We view this as what we call it as a content engine. So we take inputs from all across the organization, create the stories, and then push them back out on every channel. So you mentioned advancement communications. Our advancement team we have a great partnership with, and then they push it out in their monthly newsletter. And we feature the physicians that they think have the opportunity to inspire philanthropic donations. We post it all on our intranet, and we encourage our employees to then share it on their Facebook channel, on their social channels, and with people in their circles. We use it to feed our media relations efforts. We use it to obviously to feed our social media engine. We have a great social media team, but this content gives them more to work with. We use it internally across the entirety of the university. Ohio State has 38,000 employees. The medical center has 24,000 employees, and there's 65,000 students. So right there, you got an audience of well over 100,000, and we want them to become brand ambassadors. So that's how it works, and it's
really
a lot
great.
of fun.
Yeah, using content, authentic, emotional, connected content to amplify your brand. That is one way to differentiate the brand blur. Skip, thanks so much for joining today and sharing a little bit about what you shared here at the conference. I appreciate you finding the time.
Chris, thank you so much. It's been a great conference. I've learned a lot, and kudos to everybody who puts this together. It's been a lot of fun. Thanks, and have a great day.